rise to update the Assembly on the Government's response to the evolving COVID-19 situation in the ACT and across Australia, and the steps we have taken to keep Canberrans safe. In the period since my last update in February, case numbers and rates of hospitalisation have largely stabilised here in the ACT and across the country. However, in more recent weeks, we have seen an uptick in cases and hospitalisations in the ACT and at a national level. This change reflects the emergence of a new subvariant of the Omicron strain, and we are monitoring this situation very closely. All jurisdictions continue to move towards COVID normal with minimal restrictions and public health social measures. In the past month, we have observed the 2-year anniversary of the ACT Public Health Emergency Declaration and the 1-year anniversary of the first COVID-19 vaccine administered in the ACT. And one of the more recent innovations in our response, the COVID-19 clinic at the Surge Centre in Garran, has treated its 800th patient. For 2 years, Canberrans have worked together to slow the spread of the virus. 2 years of Canberrans social distancing and practising other COVID-safe measures, wearing masks in certain settings, and following the public health directions. And 1 year of Canberrans eagerly coming forward to get vaccinated. All done to protect loved ones and the most vulnerable members of our community. As a community, Canberrans have displayed remarkable resilience, resolve and compassion. It has been a very challenging 2 years, but Canberrans' hard work has paid off, putting us in a strong position as we move to living with COVID and being COVID smart. Madam Speaker, the BA2 Omicron subvariant is now known to have been circulating across the country since late January 2022. It has become the dominant variant in New South Wales over the past month and now also appears to be the dominant variant here in the ACT. Evidence from across the world indicates that the BA2 subvariant is even more transmissible than the original BA1 Omicron variant. However, the evidence collected so far also suggests that the new variant presents similar risks of causing severe illness. Importantly, BA2 has been made a research priority around the world, and there is no evidence of significantly reduced vaccine effectiveness against symptomatic disease. With high rates of vaccination across the country, Australia remains in a good position as we continue to transition to COVID normal. The ACT continues to work closely with the Commonwealth and other jurisdictions as the COVID-19 situation evolves to ensure our restrictions are proportionate and effective in responding to the level of risk in the community. As at 8 p.m. on the 20th of March, there had been a total of 67,243 cases of COVID-19 recorded in the ACT. There were 6,014 active cases with 39 COVID-19 patients in hospital, of whom 4 were in intensive care with none requiring ventilation. Sadly, Madam Speaker, 38 people have died with COVID-19 in the ACT since the start of the pandemic. The ACT Government extends its sincere condolences to their families and loved ones. Madam Speaker, we are seeing transmission in our schools and in early childhood education and care settings. This is not unexpected, given that these are environments where young people and educators are spending many hours together. I know this is a cause of significant anxiety for some parents. However, while children under the age of 12 are all either unvaccinated or mostly only partially vaccinated, rates of severe illness and hospitalisation remain rare in this group. We've also seen a significant cluster of cases in the Australian National University's residential student accommodation. ACT Health worked closely with the ANU to assist in managing this cluster. Importantly, overall hospitalisation rates are currently within the capacity of our hospitals. The vaccines are doing their job, interrupting chains of transmission and reducing rates of severe illness. With case numbers increasing over the last week, the ACT Government is carefully monitoring the situation to ensure our response continues to remain proportionate. The public health team within ACT Health has also commenced planning preparations for winter to ensure that our response to the pandemic can adapt to various scenarios in a manner that is flexible, scalable and agile. This planning includes considerations of testing and vaccination needs, as well as equipment requirements. We will continue to update the Assembly and the community as this work progresses. Madam Speaker, the ACT's COVID-19 vaccination program continues to be world-leading, with 96.2% of eligible Canberrans aged 5 and over having received 2 doses of vaccine. As at the 21st of March, Canberrans also continue to be among those leading the nation in their uptake of paediatric vaccines, with 79.7% of 5 to 11-year-olds having had a first dose and 33.6% having had a second, and booster or third doses with 71.7% coverage for people aged 16 and over. Our vaccination coverage is an exceptional achievement that has put the ACT in a strong position as we move to living with COVID. It represents a strong partnership between the ACT Government, primary care providers and a range of community partners, as well as the Commonwealth Government. We wish to thank everyone who has contributed to the vaccination program. We also thank every Canberran who has come forward to get vaccinated and to receive their booster dose once eligible. We strongly encourage anyone who is eligible and hasn't yet received their booster or primary doses to come forward to ensure the best protection for themselves and the community. Vaccinations are readily available at ACT Government clinics, as well as through GPs and pharmacies across Canberra. The Novavax vaccine is also available for primary doses in more than 20 ACT GP clinics and pharmacies. Madam Speaker, the ACT Government's Equity to Access program continues to make a vital contribution to our vaccination program. The program ensures that every member of our community can get vaccinated and be protected against COVID-19, regardless of their personal circumstances. The Equity to Access program provides people who are not connected to mainstream health services with the opportunity to get vaccinated in a way that is appropriate and accessible for them. This includes people from culturally and linguistically diverse backgrounds, people living with a disability and their carers, members of the LGBTIQ+ community, and people living in social housing or insecure accommodation. As part of this program, the government has resumed operating pop-up vaccination clinics. ACT Health has run several walk-in pop-up clinics so far this month across locations in Canberra City, Turner, Gungahlin, Conda and Canberra. 54 vaccine doses, primarily boosters, were administered at these clinics. Next week, additional clinics will be held across the territory in suburbs including Isabella Plains, Conda, Coombs and Turner. These clinics play an important role in making vaccination accessible to people who may find it difficult to travel to the AIS or other vaccination clinics. The ACT Health Directorate will continue to work with community sector partners and healthcare providers to identify areas of the community where targeted programs and assistance are needed. Canberra Health Services also continues to offer in-reach vaccination to patients in settings such as hospitals, mental health units, dialysis centres, adult incarceration centres, disability hubs and methadone clinics. This year, the Equity to Access program has delivered 351 vaccine doses to members of our community who may not otherwise have been able to access this vital healthcare. This brings the total to almost 2,500 vaccine doses in the program's lifetime. Madam Speaker, equity is a core value of this government and this program is well and truly delivering that. In addition to our vaccination program, the ACT's test, trace, isolate and quarantine or TTIQ policies also continue to play a crucial role in our COVID-19 response. Pressure on our testing system had eased since my last update in February. Over the last month, ACT government testing sites have conducted between 1,281 and 3,689 tests per day, with an average wait time of around 30 minutes to an hour. Over the last week, however, we have seen an increase in demand for our testing clinics, which reflects the increase in case numbers. The demand for testing clinics will be carefully managed and the ACT government will respond accordingly, noting that there is now also an adequate supply of rapid antigen tests, or RATs, across the community. Over recent weeks, it's become much easier for Canberrans to find RATs on the shelves of local pharmacies, supermarkets and other retail outlets. Eligible concession card holders can access up to 10 free RATs over 3 months under the National Rapid Antigen Testing Concessional Access Program. In addition, at its meeting on the 11th of March, National Cabinet agreed to extend the Concessional Access Program until the 31st of July 2022. Over the 3-month period, an additional 10 free RATs will be available to eligible concession card holders. The ACT Government also continues to provide RATs to essential workers within the ACT Public Service, workers who provide support to vulnerable people and to all ACT schools. With RATs now playing a significant role in our testing system, from 11:59 p.m. on Friday the 25th of February, anyone who tests positive to COVID-19 via a RAT is required to report their result to ACT Health via the online notification form available on the ACT COVID-19 website. We've seen a strong take-up of RATs in the Canberra community. As of yesterday evening, Canberrans had reported 22,759 positive RAT results since the form to report these results went online. This is approximately 34% of total cases reported in the ACT. A person who tests positive, whether by PCR or RAT, is also required to notify their employer or educational institution of their result if they attended these places during their infectious period. Persons who test positive for COVID-19 are also encouraged to take reasonable steps to notify any potential high-risk or moderate risk contacts. In recognition of the ACT's exceptional vaccine coverage and to bring us in line with other jurisdictions, the ACT government has also amended quarantine requirements for international travellers. From 11:59 p.m. on the 21st of February, unvaccinated travellers arriving from overseas are only required to quarantine for a period of 7 days. While unvaccinated travellers still need an exemption to undergo their quarantine period in Canberra, vaccinated travellers no longer need to complete an online declaration prior to entering the ACT. From 11:59 p.m. on the 16th of March, the guidance for overseas travellers was also amended to permit travellers to enter high-risk settings and education settings after returning a negative COVID-19 test within 24 hours of arrival in Australia. Previously, international travellers were restricted from entering these settings for a period of 7 days for education settings and 14 days for high-risk settings. International travellers who have been diagnosed with COVID-19 in the 9 weeks prior to their entry into Australia are also no longer required to undergo a COVID-19 test within 24 hours of their arrival into Australia. Madam Speaker, Check in Canberra continues to play an important role in our TTIQ strategy. As of the 4th of March, the app now sends you a notification if you've checked into a location around the same time as someone who has been diagnosed with COVID-19. If you receive this message, you should monitor for COVID symptoms and get tested if any develop. These notifications will only be sent if you've checked in at a high-impact location, including registered clubs, licensed bars and pubs, nightclubs, strip clubs and brothels. We continue to ask other businesses and venues where Check in Canberra is no longer mandatory to keep displaying the QR codes, allowing people to use the app voluntarily to maintain a record of where they have been. Madam Speaker, as you know, the Chief Health Officer and her team are continuously reviewing current public health social measures to ensure that they are proportionate to the current level of risk. Up until late last week, we'd seen a fall and then stabilisation in case numbers, indicating a decreased level of risk to the community. In addition, given the ACT's porous border with New South Wales, there had also been a need to adjust our settings to align with changes announced by the New South Wales Government in order to avoid confusion. This is essential in ensuring compliance. The Chief Health Officer therefore recommended changes to several public health social measures. From the 16th of February, the Government began a program of gradually easing restrictions across a range of areas. Restrictions on visitors in health facilities have been eased, allowing Canberrans easier access to their loved ones while in hospital. Patients are now able to have 2 visitors per day. For adult patients, the 2 visitors must be at different times. However, children and young people admitted to hospital can have 2 parents or carers visit them at the same time, with 1 parent or carer permitted to stay with them overnight. Women admitted to hospital for birthing-related care can now have 2 support people with them. Visitors to high-risk wards, such as the Canberra Region Cancer Centre, may be asked to undertake a RAT prior to visiting. There are many patients in these wards who have treatment that lowers their immune system response, and it is important to reduce the risk of infection to these vulnerable patients. Compassionate exemptions to these restrictions will continue to be assessed on a case-by-case basis in consultation with the patient's care team. Madam Speaker, restricting visitors to healthcare facilities is not a decision that is ever made lightly. While it is important to protect the health and safety of patients and staff, we are conscious of the impact these restrictions have on the community. The Government acknowledges the difference it makes to patients when a loved one can be with them while they are in hospital, and the distress caused when this is not possible. We hope that the easing of restrictions has offered some relief to patients and their loved ones. The ACT Government also recommenced Category 2 and 3 elective surgeries at Calvary Public Hospital from the 21st of February. The reduced pressure on our frontline COVID-19 response has allowed redeployed healthcare staff to return to the hospital. Since the 21st of February, Calvary Public Hospital has gradually returned to full capacity and is working to an average booking of 40 or more elective surgeries per day. In addition, Calvary Public Hospital is also working actively with their private hospital partners to deliver, at no extra cost to the Territory, elective surgeries above that number. This will accelerate catch-up for the temporary pause in elective surgeries. With the latest increase in case numbers, our health workforce is again being stretched as co-workers test positive. My thanks to those teams who continue to step up to care for our community. Significant recruitment is occurring across the system to ensure we can safely staff all areas. Canberra businesses were also able to largely return to business as usual from 6 p.m. on the 18th of February. Density limits on all restricted businesses have now been removed, as well as restrictions on eating and drinking standing up and dancing in hospitality and other venues. In addition, event organisers now have one less thing to worry about, as events are no longer required to have ticketing or pre-registration. From 11:59 p.m. on the 25th of February, the government also removed the requirement for events with more than 2,000 attendees to seek an exemption. Organisers of events of more than 5,000 people will still need to submit a COVID safety plan to ACT Health for review. The ACT government has also changed its advice regarding working from home. Employees can now return to the workplace where it suits them and their employer. Mandatory face mask requirements also eased from 6 p.m. on the 25th of February. Canberrans are now only required to wear a face mask if they are on public transport, including buses, light rails, taxis, rideshare and demand responsive vehicles. An employee or visitor at a high-risk setting, including hospitals, residential aged care facilities, correctional facilities or residential accommodation facilities. A worker who provides services to a person with a disability. A worker for in-home and community aged care providers. A staff member, visitor or student in years 7 to 12 in all indoor spaces at a school or early childhood education care setting, or inside the Canberra Airport terminal or on a domestic flight in or out of Canberra Airport. In these settings, exemptions are still in place for people who cannot wear a mask safely. It is also important to note that while masks may no longer be mandatory, they are still strongly recommended in indoor settings where social distancing is difficult to maintain. Madam Speaker, I now table the Chief Health Officer's 24th report on the status of the public health emergency due to COVID-19. The report covers the actions taken by the Chief Health Officer and ACT Health's COVID-19 response in the 30 days to the 7th of March 2022. The Chief Health Officer has advised that it remains necessary to maintain the effective TTIQ and public health social measures that I have just outlined. Madam Speaker, at the beginning of my statement, I noted that we have now observed 3 significant milestones. The first anniversary of the first COVID-19 vaccination administered in the ACT, the second anniversary of the Public Health Emergency Declaration and the 800th patient treated in the COVID-19 clinic at the Surge Centre in Garran. I'm sure we can all agree that it has been an extraordinary 2 years. Our community has been faced with unprecedented challenges. Governments, communities and individuals, particularly young people and people who are more vulnerable to COVID-19, have been forced to make changes and sacrifices that we would never have considered or thought possible before 2020. We've faced these challenges together. Canberrans have displayed incredible adaptability, strength and compassion. I want to acknowledge that these milestones represent countless hours of hard work on the part of our public health team and healthcare workers, who have been on the front lines of our COVID response since the very beginning. The government expresses its sincere thanks to every one of these workers for their invaluable service. We would not be in the good position we are in today without your hard work and dedication to the community. Madam Speaker, there is good reason to be cautiously optimistic as the ACT continues to move towards a new normal. The government continues to focus on supporting the Canberra community as we learn to live with COVID by being COVID smart. Thank you again to Canberrans for your continued efforts to protect the health of our community. I present a copy of the statement and move that the Assembly take note of the paper.
Question is that that motion be agreed. Those of that opinion say aye. To the contrary, no. The ayes have it. Staying with ministerial statements.